According to the World Health Organization, depression is the leading cause of disability and ill health. Globally, more than 280 million people, or 5% of the adult population, is living with depression. Depression is not the same as regular mood changes and feelings about everyday life. Depressive episodes may last for most of the day, nearly every day, for at least 2 weeks, and can impact all aspects of life, including relationships, and result in problems at school or work. Symptoms of depression include feeling sad, irritable, and empty, feelings of excessive guilt or low self-worth, hopelessness about the future, and thoughts about dying and suicide, changes in appetite, weight, and disrupted sleep, and having low energy and feeling very tired. If you are concerned that you may be living with depression, please contact your healthcare provider. There are many barriers to receiving treatment for depression, including social stigma associated with mental health disorders and a lack of trained healthcare providers. Even though psychological actions are the first treatments for depression, the value of self-care should not be underestimated. Self-care includes connecting with friends and family, regularly doing activities you enjoy, participating in physical activity, talking to someone you trust about your feelings, avoiding risky substances such as alcohol and illicit drugs, and maintaining regular sleeping and eating habits. If you noticed from the list of self-care practices I just referenced, physical activity is recommended. Exercise has a moderate effect on depression when used alone or in conjunction with other treatments, and is a great option because there are few barriers to entry. According to one systematic review, walking, jogging, yoga, strength training, and dancing are all effective modalities for impacting symptoms of depression. In addition, the benefits from exercise may be dependent upon the intensity of activity performed, with more intense activity yielding more benefits. However, if you are thinking about becoming more physically active, it is important that you start at an intensity that is appropriate for your current fitness level and to work up to greater intensities as your level of fitness improves. Remember, it is important to move more and sit less throughout the day, and doing some physical activity is better than none. Nearly 300 million people are living with depression, so you are not alone if you are experiencing any of the signs and symptoms I mentioned earlier. If you need help, don't be afraid to ask for it, and use self-care practices to get moving in the right direction.